Hey guys, Frank Cawley here from Cawley Physical Therapy and Rehab. I wanted to shoot this quick video for you regarding herniated discs. It's a common thing that we see in the clinic. It's a common thing that comes up with questions from people. So we wanted to give you kind of the who, what, when, where, why of herniated discs. So here you go. So first of all, a herniated disc typically is going to be caused by some form of trauma. That trauma could be a car accident. That trauma could be a slip and fall or falling from a higher level or something of that nature, trauma related. Secondly, typically a herniated disc is going to be the common cause of back and leg related pain symptoms in people who are 35 years of age and younger. Does that mean someone 60 or 70 can't have a herniated disc? Absolutely not. But does it mean it's the common cause of their back pain or leg symptoms? No. Typically, you're going to see that with a 35-year-old who is in some form of trauma and has symptoms coinciding with a herniated disc. How is a herniated disc determined? Well, first of all, you determine a herniated disc based on the level of the two vertebrae that it sits between. So these are the bones. This is the disc that sits in the middle. You'll see at the top here, here's two normal vertebrae with a normal disc sitting in between. It's much like a jelly donut where it has it has a fibrous or doughy outside, and then inside it has a gelatinous center. When that gelatinous center gets pushed too far out towards the edges of the doughy outside, it can puncture through, and that results in a herniated disc. What happens is typically that herniated disc pushes out into the back or side of the spine. So this is the front of the spine towards the stomach. This is the back of the spine towards the lower back. We're looking at the lumbar area here where herniated discs are very common. So a disc is going to herniate. When it herniates out, it sits in this opening, this white opening right here, which is where the nerve passes through. You're going to see in the next image that I'll show you here, here's a really good indication of a herniated disc that's pinching a nerve, causing sciatic-like symptoms, which could be numbness, tingling, burning, going down the leg. We can easily determine what level this disc is herniated at because there's 5 levels in the lumbar spine, levels 1 through 5. And basically a herniated disc is named by the two vertebrae that it sits in between. The most common level for a herniated disc in your lumbar or lower back is the L4, L5. So the L4 vertebrae, the L5 vertebrae, the L4, L5 disc is herniated, pinching the L4, L5 nerve root right here and giving you symptoms of possibly numbness, tingling, burning, weakness going down your leg from your buttock, down the back of your leg, wrapping around the outside of your knee, down the front of your shin to the top of your foot, possibly all the way towards the big toe. That's how we could determine that it's the L4, L5. If it was L3, L4, or down at the bottom, the very bottom one, L5, S1, we can determine that based on your symptom complaints. It's not uncommon to have leg symptoms on both sides. That just means it's a central disc herniation, as opposed to having one side leg symptoms. That's typically the side that the disc is herniated towards. Here's a really good image here that you could see. You'll see on MRI that we're showing in this picture here. This is a great depiction of an L4-5 herniated disc where the material, the gelatinous center, has pushed out from inside the disc. It's sitting in the spinal canal right here. This is the spinal cord, the darker gray right here on the backside. The white is your cerebral spinal fluid. This is a big herniated disc putting pressure on that L4, L5 level of nerves, and they're definitely going to notice symptoms here. So again, it's a herniated disc, which is different than a bulging or protruded disc, which is a little less in significance, but sometimes still quite painful. But again, the most common level is L4, L5. It's usually trauma related. It's usually in someone 35 years of age or younger, but can happen to older people. And a herniated disc usually results in symptoms such as tingling, burning, numbness, and or weakness in the distribution of which the nerve that is affected by the herniated disc. So I hope you found this helpful about herniated discs. As always, if you have any questions, give me a call at 570-208-2787. Otherwise, that's your video.